Dear students, welcome back. In the previous session, we have discussed about the functions of the components of the typical vertebrae. Now in this session, we are going to discuss about the intervertebral disc in detail. So, in our vertebral column, we found 23 intervertebral discs from the cervical region to the sacrum, that is from C2, C3 mobile segment to L5, S1 mobile segment. Okay, the intervertebral disc is a part of the mobile segment that we have discussed earlier, and if you see this intervertebral disc, it is having two main functions. One is to separate the vertebral bodies. Okay, it is separating the two vertebral bodies, thereby it helps in increasing the available range of motion, and also the other function of the intervertebral disc is to transmit the load from one vertebral body to the adjacent vertebral body. So therefore the size of the intervertebral disc is related to both the amount of motion as well as the magnitude of the loads that must be transmitted. So these are the two main functions of the intervertebral discs. Okay, the intervertebral discs, which make up 20 to 33% of the total length of the entire vertebral column. And if you see the size of the intervertebral disc, which increases from the cervical region to the lumbar regions. Okay, the disc thickness varies from approximately 3 millimeters in the cervical region, where the loads, weight-bearing loads, are lowest, and to about 9 millimeters in the lumbar region, where the weight-bearing loads are highest. Okay, so although the discs are smallest in the cervical region and largest in the lumbar region, here we have to consider the ratio between the thickness of the intervertebral disc as well as the height of the vertebral body, which determines the available range of motion at that particular segments. Okay, if greater the ratio, greater the mobility in that region, and lower the ratio means the mobility is less. Okay, so the ratio of these two, the ratio of the thickness of the disc as well as the height of the vertebrae, is more at the cervical region, next the lumbar region, and next thoracic region. So all these variations reflects the greater functional needs for mobility in the cervical region and lumbar region, and stability need in the thoracic region. These are all the general information about the intervertebral discs. Now we will move on to the structure of the intervertebral disc. Yes, here we can see the intervertebral disc in the coronal section as well as the transverse section. The intervertebral disc consists of three parts. One is Nucleus Pulposus, and next one is the Annulus fibrosus, second one, and next one is the third one, that is vertebral end plates. So the intervertebral disc composed of three parts. So one is the nucleus pulposus. We can find this nucleus pulposus as a gelatinous mass found in the center of the disc. Okay, and the annulus fibrosus is the fibrous outer ring, which are arranged in the form of layers around the nucleus pulposus. Okay, so the annulus fibrosus covers the nucleus pulposus. Okay, and this annulus fibrosus forms the outer ring of the intervertebral disc. And the next one is the vertebral end plates. The vertebral end plates covers the superior and inferior surfaces of the disc, okay, separating from the superior vertebral body as well as the inferior vertebral body. Okay, so and this vertebral plates mainly separates the disc from the vertebral body at the region of the cancellous bone, that is the spongy bone area. So we have already discussed about the cartilaginous end plates, which is nothing but vertebral end plates which are covered on the vertebral body over the spongy bone only. So in that area, this vertebral end plates separating the disc from the nucleus pulposus with that of the vertebrae. Okay, and some part of this annulus fibrosus also. Okay, so these are all the parts of the intervertebral disc. Now we will see the composition of the intervertebral disc. So here we can find this one is the nucleus pulposus, isn't it? Yes. And next one is the here you can find this one is the annulus fibrosus, isn't it? Yes. And next one is the intervertebral or vertebral plates. Okay, vertebral end plates. If you see the composition of all the three, so all the three consists of mainly three things. One is the fluid content, that is water, and next one is the proteoglycans, concentrate proteoglycans, and next one is the collagen. Okay, these are the three main compositions of the three parts. So intervertebral disc consists of three parts, and the composition also consists of three things. So the three things are, one is water, next one is the proteoglycan, and next one is the collagen. Here although all the three having the same composition, but the percentage of these compositions are going to vary. Okay, if you see at the nucleus pulposus, we will find more water. Okay, and next one is we can find proteoglycans more and collagens less. Okay, so if you see at the annulus fibrosus, okay, annulus fibrosus, we can find again water, 70% of water, so which is somewhat lesser than the nucleus pulposus, and only 5% of proteoglycans we can find at the annulus fibrosus, and 15% of collagen we can see at the annulus fibrosus. Okay, and we will move on to this what you call as vertebral end plates. This vertebral end plates also consists of water, which is less, that is only 55%. Proteoglycan is also less compared to the nucleus pulposus, that is only 8%, and collagen 25%. Okay, these are all the percentages of all the three. Okay, so because of these compositions, the functions are going to vary. Okay, so if you observe the compositions, the fluid content is highest in the nucleus pulposus. Okay, and also the proteoglycan content is also highest in the nucleus pulposus, and it also having collagen. It is having two types of collagen. One is type 1 and type 2 collagen. This type 2 collagen is more in the nucleus pulposus and type 1 is less, because these type 2 collagen fibers are designed in such a way that it resists the compressive forces. Okay, so in the nucleus pulposus, if we observe, what will happen? We can take a water balloon as an example. The same way this nucleus pulposus is going to work. Okay, when we deform or so if you take a balloon like this, so if you can apply some pressure over this balloon, what will happen? The balloon deforms like this, isn't it? The balloon deforms like this. The same way the disc is also going to deform. That means this pressure what we have applied on the balloon is spreading towards the walls of the balloon and deforms its shape. The same thing is also happening in the nucleus pulposus. If you apply some compressive forces, that the thing we can see here. Yes, this is the normal nucleus pulposus, which is seen at the center. This is annulus fibrosus and this one is the vertebral end plates. Okay, so the round ball is the nucleus pulposus. So under compressive loading, the pressure is exerted in all the directions as the nucleus pulposus is going to expand. Okay, so tension in the annulus fibrosus. So the tension in the annulus fibrosus rises as a result of the nuclear pressure. Because of this pressure, so some tension is developed in the annulus fibrosus. So this tension, whatever created in the annulus fibrosus, is the main cause to give an opposite force. Okay, give an opposite force to this force which is created in the nucleus. Okay, and which restrains radial expansion of the nucleus pulposus, and this equal and opposite reaction force establishes the equilibrium. Some of the nuclear pressure is transmitted by the annulus fibrosus to the vertebral end plates also. So this is the thing happening when the compressive force is applied on the intervertebral disc. So what will happen means, during compression, the fluid which is present inside the disc, inside the nucleus pulposus, is oozed out. Okay, the fluid content. So as we know that it is having more water content, during compression the water is going to oozes out, but the proteoglycan and the collagen will not oozes out. Okay, so here these are the structures of this proteoglycans. So this is the single structure of the proteoglycan. Okay, so which mainly consists of chondroitin 6 sulfate, keratin sulfate and hyaluronate. So these, and also important things are these are the main GAGs, we can call it as, that is glycosaminoglycans. And when these GAGs are linked to the proteins to form proteoglycan molecules. So this is the entire proteoglycan molecules. Okay, so all these gags are attached to the protein core here. Okay, and finally this one is going to attach the core main protein. Okay, that is the collagen fibrils here. Okay, so these are all the structures of the proteoglycans which are present in the nucleus pulposus. So why all these things we should know means, here these proteoglycan molecules have the capacity to attract and retain water. Okay, so these chondroitin 4 sulfate and this chondroitin 4 sulfate is having high fluid attracting and fluid maintaining capacity in the proteoglycans which are present in the nucleus pulposus. Okay, this is the thing happening inside the nucleus pulposus. Okay, now we will move on to the annulus fibrosus. The annulus fibrosus are arranged in the form of layers. Okay, so here we can see these are arranged in the form of layers, and the collagen fibers which are arranged in one layer is different in the arrangement of the collagen fibers which are present in the second layer. That means if you take the two layers, the first layer arrangement of the collagen makes 120-degree angle with that of the another layer arrangement of the collagen fiber. Such kind of arrangement we can see in the annulus fibrosus. Okay, so this annulus fibrosus consists of both type 1 as well as type 2 collagen, but mainly type 1 collagen is seen in the nucleus pulposus. So the fibers are mainly used to resist the tensile forces. Okay, whereas in the nucleus pulposus it is having type 2 more than the type 1, which helps to resist the compressive forces. Okay, so these are all about the annulus fibrosus as well as the nucleus pulposus. Now we will see the vertebral end plates. The vertebral end plates are the thin layers of cartilage that cover the superior and inferior surfaces of the vertebral bodies. And the chemical composition we have already seen, which are same as that of nucleus pulposus as well as the annulus fibrosus. But if you see, the composition varies at the center. The composition varies at the center of the end plate, which is nearer to the composition of the nucleus pulposus. And if you see at the annulus fibrosus, the composition of end plate is same as that of the annulus fibrosus. Okay, and also here if you see, the collagen fibers in the end plate are arranged horizontally to withstand the swelling pressure of the nucleus pulposus, which occurs when the nucleus imbibes water or subject to axial compression. So these are all the parts and the functions of the intervertebral discs. Now we will see the innervation of the intervertebral disc. Okay, so in the cervical and the lumbar regions, the outer third of the annulus fibrosus, only the outer third of the annulus is innervated by the branches from the vertebral and the sinovertebral nerves. The sinovertebral nerves also innervates the peridiscal connective tissues. That means here what are the ligaments attached at this area which are nearer to this thing. So for example, anterior longitudinal ligament which is present at the anterior aspect, which are all, and also the posterior longitudinal ligament which are present here. So these some of the structures are also supplied by this sinovertebral nerve. If you see in the intervertebral disc, only the outer 1/3 of the annulus are innervated by the sinovertebral nerve. Okay, now we will move on to the nutrition. Okay, so if you see the nutrition, so the intervertebral disc do not receive blood supply from any major arterial branches. Okay, so the metaphyseal arteries, here you can see the metaphyseal arteries, that is which is coming as a segmental artery from the aorta. So this metaphyseal arteries form a dense capillary network. Here we can find the dense capillary first capillary flexus at the base of the end plate. Okay, at the base of the end plate cartilage, end plate cartilage, and the subchondral bone deep to the end plate. This one is the subchondral bone and this one is the end plate. Okay, so and the small branches from this metaphyseal arteries supplies the outer surface of the annulus fibrosus. This one supplies the outer surfaces of the annulus fibrosus. The remainder of the disc receives its nutrition through diffusion itself. Okay, so up to here only, up to the end of the end plates only will get this blood supply. From there the nutrients are supplied to the intervertebral disc by nutrition. So this is all about the intervertebral discs. In the next session we are going to discuss about the articulations of the vertebral column. Thank you.